everyone, this presentation is about occupational diseases, its preventive measures. Occupational diseases mean diseases caused by occupations directly or indirectly. It can be caused by exhaustion or contacts with various hazardous substances, equipments or working environments. Some common occupational diseases include heat stress, deafness, silicosis, asthma, skin inflammation, cancer, hepatitis B, traumatic inflammation of tendons or sheaths of hand or forearm. Let's brief about these diseases. Silicosis and its symptoms. Related occupations or work. Mining, tunneling, construction, pottery, using fire-resistant materials and silica abrasives. Causes. Fibrosis of lungs due to inhalation of free silica dust. Symptoms. Shortness of breath, coughing and declination of lung functions. When the disease is serious, breathlessness may occur when moving slightly or resting. Preventions. Preventions are vital since there is not yet an effective treatment. Preventions include isolating and confining the work, using local exhaust ventilation to control and keep good housekeeping. Reducing the opportunities of employees exposing to silica dust. Providing information about silica's influences on health of employees. Providing regular body check to employees exposing to silica dust. If the above measures cannot be taken immediately, breathing apparatus should be used on a temporary basis. Peripheral polyneuropathy. Related occupations or work. Occupations using N-hexane-containing glues, adhesives and degreases such as manufacture of shoes, raincoats, handbags or printing, furniture, assembling, tire retreading. Causes. Absorption of excessive N-hexane vapor in workplaces or skin contact to N-hexane-containing solvents. Symptoms. Limbs weakness, hands and feet numbness will lead to traveling difficulty or muscular dystrophy, loss of senses, and reduction of tendon reaction. N-hexane can also affect the central nervous system, damage vision and memory. Preventions. The most effective way is to install ventilation system to control air. Pollutants. Employees contacting with chemicals and solvents should use suitable PPE such as breathing apparatus and gloves. Occupational cancer. Related occupations or work. Contacting carcinogen or ionizing radiation at work. Causes. Ultraviolet radiation can cause skin cancer. Ionizing radiation can cause blood and skin cancer. Radioactive material can cause lung and bone cancer. Carcinogenic chemicals such as dust, metal, solvent, paint can cause lung cancer, skin cancer, nasal cancer, liver cancer and urinary tract cancer respectively. Contacting biological hazards such as hepatitis B and AIDS may also cause liver or other cancer. Preventions. The best way to prevent occupational cancer is to use non-carcinogenic substance instead of carcinogenic substance. The second consideration is to prevent employees from contacting carcinogenic substance such as confining the system producing or transporting carcinogenic substance, monitoring the exposure level, installing ventilation systems and to provide suitable PPE to all related employees. Skin inflammation. Related occupations or work. Work with solvents, detergents, cement, metal, meat and oils such as cleaners, painters, maintenance and construction workers, hairdresser and workers in chemical, plastic or medicine industry, food processing, agriculture, healthcare, electroplating or tannery industries. Causes. Occupational skin inflammation is a skin disease caused by contacts with chemical, physical or biological hazards. Symptoms. Red, swollen, itchy, Painful skin and blisters form over site of contact with irritants or allergens such as hands and forearms. Preventions. Identify the chemicals and irritants used in daily work. Prevent direct contact with irritants, such as substituting highly irritant substance by less irritant substance. Avoid contacting substance causing allergy. Maintain good housekeeping. Clear the spilled chemicals or other material immediately. Wear suitable PPE such as glove, apron, eye protector and face mask before dealing with chemicals or other irritants. Wash hands with neutral soap and apply hand cream immediately after work. Heat stroke and its symptoms. Related occupations or work. Working in kitchen, laundry, boiler or outdoor work. With manual operation. Causes. Human bodies cannot adapt to high temperature and produce pathological change. Symptoms. Overexposure to hot environment will lead to increase in heat load and or loss of heat dissipating functions. The following situation may occur: temporary heat tiredness, heat exhaustion, heat stroke, heat cramp, faint, heat rash. Preventions. Use heat insulating materials to reduce heat source. Install ventilation system over the heat source or other suitable position. Enhance the ventilation system. Provide resting area and sufficient water. Employees performing specific hot work should wear suitable PPE such as heat-resistant gloves, infrared reflecting mask, and aluminum reflective clothes. Deafness and its symptoms. Related occupations or work. Construction and manufacturing such as metals, textile, plastics and blasting by abrasives. Causes. Excessive noise damages sound receiving nerve cells in the cochlea and leads to deafness. Audition damage depends on the noise level and exposure time. Generally speaking, exposing to noise exceeding 85 decibels for a long time will cause potential harm to audition. Symptoms. Tinnitus, declination of hearing sense and permanent deafness. Preventions. To protect employees' audition, employers should develop a plan for protecting audition, which including perform workplace noise assessment and keep the assessment records. Implement engineering controls such as isolation and maintenance to reduce noise. Audition tests for employees. Employers provide suitable approved ear protectors. Provide training related to noise for employees. Traumatic inflammation of the tendons or sheaths of hand or forearm. Traumatic inflammation of the tendons or sheaths of hand or forearm related occupations or work. Manual labor, typist, clerk, cleaner, assemble, cashier, reparation workers, musician. Causes. It is caused by keeping the muscles of hand or forearm performing the same repetitive motion for a long time. Because of the use of force and speed of work, traumatic inflammation develops at the tendons or sheaths of hand or forearm. Symptoms. Pain, swelling and tenderness in hands, which may also spread to forearms. Preventions. Avoid bending or twisting wrists. Use the whole hand to grasp objects, not only fingers. Reduce performing repetitive motions such as persistent typing, reduce the speed and force. Use electrical or well-designed tools. Rest hands and forearms regularly and do hand exercises to relax muscles. Occupational asthma. Related occupations or work. Exposure to isocyanates, formaldehyde, proteolytic enzymes, flour and wheat. Causes. The disease is characterized by episodic airway obstruction induced by any sensitizing agents inhaled at work. Symptoms. Attacks of sneezing, running nose, cough, breathlessness or wheezing may develop within minutes of exposure, or be delayed for hours after the worker has left the workplace.
This is all about today's topic. Thanks for watching Funny Yes Info. And don't forget to subscribe our channel to get immediate notification of our videos. Share our videos to your friends and colleagues to create safety awareness. If you have any questions and requirements, please comment in comment box.